Okay, picking up where we left off from last time with HIV key facts, move into a discussion more on HIV/AIDS. HIV transmission, the exchange of a variety of bodily fluids from infected individuals, such as blood, breast milk, semen, and vaginal secretions. Individuals cannot become infected through ordinary day-to-day contact, such as kissing, hugging, shaking hands, or sharing personal object, food, or water. And depending on your age, you might recall that some of these myths had actually existed in the United States, and some of these ideas shaped the way that people that were living with HIV were stigmatized in larger society as a whole. Global HIV statistics in 2021, 38.4 million people were living with HIV. Again, you see the ranges here of between 33.9 and 43.8. 1.5 million newly infected. 650,000 people died from AIDS-related illnesses, and 28.7 million people were accessing antiretroviral therapy. Since the start of the epidemic, 84.2 million people have become infected with HIV, and 40.1 million people have died from AIDS-related illnesses. People living with HIV accessing antiretroviral therapy. At the end of December 2021, 28.7 million people were accessing antiretroviral therapy. This is up from 7.8 million in 2010. So pretty dramatic increases here, nearly 4 times in terms of the access. In 2021, 75% of all people living with HIV were accessing treatment. Access to treatment was uneven. 76% of adults 15 and older were living with HIV had access. 52% of children, 80% of female adults, 70% of male adults, and 81% of pregnant women living with HIV. New HIV infections. HIV infections peaked in 1996. In 2021, around 1.5 million people were newly infected, compared to 3.2 million in 1996. This is a 54% reduction from the all-time high. Women and girls accounted for 49% of all new infections in 2021. Since 2010, new HIV infections have declined by 32%, from 2.2 million to 1.5 million in 2021. Since 2010, new HIV infections among children have declined by 52%, from 320,000 in 2010 to 160,000 in 2021. AIDS-related deaths, these have been reduced by 68% since their peak in 2004, and by 52% since 2010. Deaths from AIDS-related illnesses, 2021, 650,000 people. 2010, 1.4 million people, and 2004, 2 million people. AIDS-related mortality by gender since 2010 declined by 57% among women and girls, and 47% among boys and men. Every week, around 4,900 young women aged 15 to 24 become newly infected with HIV. In sub-Saharan Africa, 6 in 7 new HIV infections are among adolescents between 15 and 19 years of age. Girls and young women aged 15 to 24 are twice as likely to be living with HIV as young men. In sub-Saharan Africa, women and girls accounted for 63% of new infections in 2021. The investments at the end of 2021, $21.4 billion US dollars in 2019 constant US dollars was available for the AIDS response in low and middle income countries. Around 60% of this was from domestic sources. UNAIDS estimates that $29 billion US dollars will be required for the AIDS response in low and middle income countries, including countries formerly considered to be upper income countries, in 2025 to get on track to end AIDS as a global public health threat. So, situating some of that information in the context of what anthropology can contribute. So, medical anthropology is a subfield within anthropology. It draws from cultural, biological, and linguistic anthropology as well as archaeology. It's a holistic discipline, and it helps us to better understand the factors which influence health and well-being, broadly defined and cross-culturally defined, the experience and distribution of illness, the prevention and treatment of sickness, healing processes, the social relations of therapy management, the cultural importance and utilization of pluralistic medical systems, so many different types of treatments that are being offered. The origins of medical anthropology, before it became a specialization within anthropology, anthropologists were studying health, healing, medicine, wellness, sickness, all of these types of things. Physical anthropologists were always interested in health and disease. They were interested in this to help to identify the cause of death as well as assess the health of ancient societies. Jared Diamond's work, The Worst Mistake in the History of Humankind, is one of these examples that traces the health and well-being looking at skeletal remains, or draws from that research in his discussion of the transition to agriculture and its impact on human health. Cultural anthropologists were initially interested in this in passing chapters on magic or religion. Early work in anthropology includes that of W.H. Rivers. He worked in the Torres Straits north of Australia. For Rivers, diseases are believed to be caused by human agency, that is magical, spiritual, or supernatural agency, taboo, and or natural agency. The focus for Rivers was on human agency. The practice of medicine is a social process, subject to the same laws to be studied by the same methods as any other social process. And he insisted that the healing practices of so-called primitive people are logical and systematic, in some respects more rational than our own. And so, if you recall back to Horace Minor's body ritual amongst the Nasarima that we discussed in an earlier screencast, where he talks about the body ritual practices of Americans and the Los Posito, or the hospital, the mouth medicine man, or the dentist. We also, if you're also thinking back to some of these earlier discussions, you might recall that Franz Boas's idea of cultural relativism and statements of cultural relativism. I think we have a relativist statement here in terms of judging individuals in the context of their own culture, rather than making assumptions that your culture is superior to another, as we would see in ethnocentric assumptions. Erwin Acherneck, he was a medical doctor, MD. He wrote essays in the 1940s and 50s and explored how ideas about diseases reflected social tensions in society, attributing disease to witchcraft performed by political enemies, for example. He argued that the very threat of disease, or being accused of causing one, can serve as a powerful social sanction supporting the status quo against those who are inclined to deviate from social norms. He was amongst the first to argue for the cultural construction of disease in this statement. What is disease is, in the last instance, not a biological fact, but a decision of society. And of course, we see this in discussions, Michel Foucault's discussion of the birth of the clinic, the ship of fools, how individuals come to be recognized as ill, and also the distancing of medical practitioners and the professionalization of this. Anthropologists and medical anthropology also, some of the origins of this come from consulting work. So anthropologists were very active post-World War II. Lots of work in trust territories, including the Federated States of Micronesia. But we also see consulting in a variety of other settings as well. The final catalyst for anthropological research specifically focused on health and disease. Adams' 1955 work on village resistance in Guatemala to child nutrition programs supported by the World Health Organization and the Institute of Nutrition of Central America and Panama. Basically, what was going on here is they were taking children's blood, and the belief locally was that because these folks were coming in from the outside and taking the children's blood, this was negatively impacting the health of the children. So the samples were seen as a permanent loss of strength. And this also tied into popular mythology that when the colonists were coming in, the whites would fatten them, basically be fattening up Indians in order to eat them. So so the idea was that this nutrition program was to fatten up children again, to eat them. Of course, this, realizing these practices and beliefs about what was going on showed the why this resistance was occurring to this nutritional intervention. Caudill's 1953 work notes that the notion of applied anthropology medicine predates the widespread use of the term medical anthropology. Paul's 1955, he published a series of case studies of applied work in international and domestic public health projects. The professionalization of medical anthropology really came about with the Society for Medical Anthropology, which was formed in 1967 and incorporated into the American Anthropological Association in 1971. They hold annual meetings. You can look up the Society for Medical Anthropology, and you can read their meeting minutes online. And for their business meetings, you can attend their annual conferences. They also have a number of sessions at the American Anthropological Association's annual meeting. They have produced historically a number of journals, including Medical Anthropology Quarterly. So the approaches in medical anthropology, there are four main approaches, and in truth, many medical anthropologists would combine elements of all of these to varying degrees in their study. First, the cultural constructive or interpretive framework. This is the cultural construction of sickness. So going back to some of these earlier theorists, how a society's understanding of and responses to disease are shaped by cultural assumptions about the beginning and end of life. And, we have particular beliefs in the United States, for example, about when life begins and when it ends. And of course, that shapes a lot of things like public policy and law, and also the right to life and the right to take away life. So really interesting questions about this in terms of individual agency and bodily autonomy versus other assumptions about where the beginning and end of one individual life is. The workings of the human organism are also addressed, as well as the causes of ill health and misfortune. The ecological or ecological evolutionary approach looks at the interaction between socio-cultural patterns and biological environmental parameters within which we live, and looks at the idea of adaptation, short and long-term implications for human health in different environments and social arrangements. So things like shifts in diet and how this can impact health. Critical medical anthropologists draw from the political economy of health as well as Marxian theory, and they look at how the distribution of wealth and power and the division of labor affect disease patterns and healthcare access. Also, here you would see discussion along the lines of social inequality more broadly defined, not just along the lines of class. And then the application in the context of healthcare, so applied medical anthropology.